Documentation is a big part of nurse practitioner job. It's not the most fun job for many of us, including myself, but sometimes it can drag you, you might have to work extra hours or extra day to just finish your documentation. So it's very important to learn how to speed up your documentation. So in this episode, I'm going to talk about 3 tips to speed up documentation. Hey, before we're gonna get into today's topic, I just want to mention that we are giving out free online lesson. It's about time management. We all are very busy every day, but we want to make sure that we have time to take care of ourselves. Because when we are too stressed out, then we can't really take care of other, people, patients, or even our loved ones. So it's very important to take care of ourselves. But I think the problem is we don't have time. But in this lesson, I'm going to talk about 7 secrets to make time for things you love so you can rejuvenate and be a better person, better nurse practitioner, better healthcare professional. How to access this online lesson is you can go to usa.jnpproject.com/free lesson. Again, usa.jnpproject.com/free lesson. And you can get access to this free lesson. All right, let's get back to today's topic. So documentation is a big part of nurse practitioner's job. Documentation is not only important to show that you did what you're supposed to do, but also to get reimbursed from insurances for procedures and the visits to show that, yes, this visit was very complicated, so I should get paid more for this visit compared to uncomplicated case, or to show that you did procedures and you get reimbursed for the procedure fee. But also, it's very important because it's a way of communication with other providers and healthcare professional to show what you did, what you were thinking, what was your plan. Also to remind you what you discussed with patients at the time. So it's very, very important. But to me, it's not the most fun part. I love talking to my patients. I love educating them. I love discussing, their options and listen to your concerns. But documentation is not the very fun part. But I know that it's very important. So we want to make sure we speed up your documentations as much as you can so you can finish work on time and you can just enjoy your life. And this was a problem when I was a nurse practitioner student and newly graduated nurse practitioner. I used to go in hour before to finish my documentation or prepare, and then I stayed later, or I did documentation on my days off to catch up with my notes. So very important to learn how to speed up the process so you can finish work on time and enjoy your life and have satisfaction in your life overall. So I'm going to give you 3 tips. Number 1, when you are talking to your patients, write down in the EMR, write down some key words and phrases. I used to take notes and then I look at the notes and then I transfer the notes. But I realize you're gonna document in EMR eventually anyway. So you should just omit the processes writing on the paper and then transfer the note to the computer. So I decided I'm gonna just write on the computer right away. Now, when you're writing down, you don't want to be disrespectful to your patients and just focusing on your notes and not show that you're actually listening to the patients. Obviously, you're probably listening, but the patients wants to have good eye contact so they know that they can trust us. They know that we're listening to their concerns. So you don't want to just do like this the whole time. But you can write down important phrases and words. So when you actually have time to document, that can be a trigger phrases or words for you to remember, okay, this is what she said, he said, or this is what I was thinking about. So what kind of key words and phrases should you document when you are actually with a patient or right after the visit? But you have to go see other patient really quickly. You don't have time to finish the whole documentation, but you want to make sure you have enough memo for yourself to document later on. So include pertinent negative to rule out the disease. So for example, if patient comes in complaining about fever and pain with urination, you might think, oh, she might have UTI or pyelonephritis. So let's say you're thinking of you performed CVA tenderness, costovertebral angle tenderness. So you checked and it was negative. And that's a very important information to show that you did pay attention to that and it was negative. Therefore, you are ruling out pyelonephritis, which is a kidney infection. So instead of writing down the whole thing, you can just note. I usually note what's those pertinent negative, even though your diagnosis, let's say UTI, but you also want to show that I know the differential diagnosis include pyelonephritis. However, I rule out because of this. But you don't have to write down whole thing. You just say CVA tenderness negative. So that the key phrase is to remind you. And that's the fast way to show the readers, say, hey, I know that was a part of the differential diagnosis, but I ruled out, I thought that there was low risk for pyelonephritis because it was negative. So include pertinent negative. And also include pertinent positive. So let's say, if a patient actually had CVA tenderness, you should definitely write it down, and so that you can show, hey, this is why I diagnosed with the pyelonephritis and decided to give medicine for that infection. So write down, you don't have to write just general normal results that is not really directly related to that diagnosis. So like normal lung sounds and stuff, you don't have time. And then also you're not supposed to spend too much time on the notes when you're speaking to patients, or even right after the visit, you have to move on to see other patient, because remember, you have to run the clinic smoothly. You don't want patients to wait, too long and they get very angry. And of course, they're entitled to be angry. They have very busy life. We want to be respectful to their time. So, but to write down some notes, write down pertinent negative and positive. And also, again, don't write down everything. When you're with patients or when you have to see other patient right away, just write down important key phrases to just remind you, not the whole sentences, just the words or phrases to remind you, hey, we checked the CVA, it's negative. So it's kind of like a signal for future yourself to signal, say, hey, this is what I was thinking about. This was the finding. I also realize that putting diagnosis can be very helpful, especially if you are diagnosing some if you come up with a new diagnosis. I put diagnosis. If you see so many patients a day, and when you finally have time to sit down and document, sometimes it's hard to remember what you discussed, what you were thinking, because you have so many notes piling up. And hopefully that's not the case, but that can happen. I usually try to finish my notes for the morning before lunch, and then notes for the afternoon before I leave, so that I don't accumulate the whole day or days of documentation. Because then when you think, you have to be like, oh shoot, what was I thinking? What did she say? What was I thinking? what did I discuss or what did I find, and just to think and remember. Well, first of all, it could be inaccurate because your memory is fading out. So you want to make sure, for your safety and your patient's safety, it's very important to document on time so the documentation is accurate. But also you're wasting your time just to think and remember and guessing. So you want to make sure you do documentation on time. But what I found is putting diagnosis, especially if you're diagnosing new conditions and coming up with new diagnosis, I usually put diagnosis like PCOS. And you can put like elevated testosterone level, irregular period, or you don't even have to. Maybe that diagnosis itself reminds you what I was thinking. So try to put those little information before you move on to next patient, just to a little key phrases and words to remind your future yourself what you're thinking at the time. But remember, don't write down everything because like I said, you don't want to be disrespectful to patients by documenting everything in front of them. Second is summarize. So let's say you have time, maybe you have no shows or you just have time to sit down and document now. Okay, but remember, this is a struggle for me when I was a student and even as a new grad nurse practitioner, because when you're in school, you also write so many academic papers, research papers. And then in academic papers, you have to write in certain ways. You have to be wordy, to sound academic. So what I struggle with is switching my brain. When you're in clinical, we're not writing research papers, academic papers. When you're in clinical setting, your documentation has to be concise, meaning that it has to be short, but also contain all the important information. So very important to keep in mind that when you're in clinical setting doing the documentation, you're not writing papers. And I noticed that this is a problem for so many nurse practitioner students. And I can see why, because you're taught in school, you have to be like, according to this, this is evident because of this and that. But remember, in clinical side, you document differently. And think of ways to express same thing in less words. So for example, instead of saying patient stated that she didn't have cough, you can document instead that patient denied cough. See, instead of patient stated that she didn't have cough with 7 words, you can say 3 words, patient denied cough or denied cough. Then boom, that's it. So think of a way to express same thing in more concise ways, shorter ways. And you can also definitely look at other people's notes and see how they express. That's how I learned how to document. I love reading other people's notes. When my patients see specialists or ER, I look at the documents and I learn so much from good documentation. And I pick and choose what I can use for my documentation. And it's probably the fastest way to learn effective documentation. But yeah, think of the ways to say same thing in less words in a more concise way. Third tip to speed up your documentation is don't get distracted. Sometimes I'm not good at this, but I'm trying to be good at this because if you are distracted, one, you might be missing some points or your notes can be inaccurate, which can be dangerous for patients, and also liability-wise, it can be dangerous for yourself. You might forget to put on something. You might be thinking, and then you get sound like an email coming in and you're like, oh, what kind of email did I get? And then you read email and then you forgot. And also you have to be like, okay, now I can document. Wait a minute, what was I thinking? Or then you have to spend time to remembering what you were thinking. So when you are doing documentation, as much as you can, some of them are not, you might not be able to control. Like maybe the other healthcare professionals calling you and you have to take the call right away, then obviously you have to prioritize that over your documentation. But try to eliminate distracting factors and focus on documentation. Maybe you can use do not disturb mode on your phone so you don't have to like check your text messages or Instagram or, or calls that is not urgent, and you can focus on documentation and finish your notes efficiently. That is very, very important because, again, it saves your time, but also saves your butt. Because, again, if you're distracted, you might forget important things that you're supposed to input. You might forget to input procedures you actually did, but you got distracted and then you forgot to put it in, and now you don't get reimbursed. That is a loss for the clinic and also possibly for yourself as well. It's not safe for a patient. So try not to get distracted. Try to eliminate distracting factors as much as you can, and so you can go home on time. I do these things, and now I was chosen as the only nurse practitioner for outstanding provider at the health center that I work at. But I go home on time, I go surf after work, and I'm pretty happy with my life. I see other colleagues who actually see less patients but stay longer, very unhappy with their work because they have to sacrifice their private time and they stay longer. I realize that it's because they're not efficient in documentation. So try these 3 tips and hopefully that's helpful. Please share with us if you have any other tips or if you have any questions or requests for future topics for this YouTube video and podcast. All right, I'll see you guys in the next episode. Aloha.